ADHD is a neurodevelopmental disorder, which stands for Attention Deficit Hyperactivity Disorder. The core symptoms of ADHD are inattention, hyperactivity, and impulsivity. These become a problem when they are exaggerated compared with the child or young person of similar age, and when they start affecting the young person with their learning, school life, friendships, social and family life. Thinking about individual symptoms of ADHD, the inattention can present like difficulty with concentration, losing focus easily, getting distracted, you're not able to listen, remember, or follow instructions, being forgetful, losing and misplacing things, taking a long time to start the work and also finish the work, and struggling with organizations. And sometimes you have experiences of zoning out or daydreaming. The symptoms of hyperactivity presents differently at different ages. In children, you might notice them being more energetic, very active, running around and climbing onto things. And as the age progresses, sometimes you see them being unable to sit still, being fidgety, being restless, constantly fiddling with things, talking too much, and difficult to interrupt them. They are being loud and noisy as well. In terms of impulsive symptoms, basically impulsivity means doing things without thinking. Making a diagnosis of ADHD requires a specialist assessment. The GP has to make a referral to a psychiatrist, which is a child and adolescent psychiatrist, pediatrician, or an adult psychiatrist. And the assessment process includes gathering information in the initial assessment about presentation, the risks, the developmental history, medical, family history, and observing the child or the young person in the clinic. Following this, parents and teachers, along with, depending on the age of the young person, sometimes the young person need to complete the Connors ADHD questionnaire. Sometimes we might have to ask for a computerized test called a QB test, which needs to be done to assist in the diagnosis. If there are any additional needs identified, especially with regards to learning or cognitive difficulties, then we might have to get some more information and assessments completed by the educational or clinical psychologist. ADHD can present with the different behaviors depending on the age, setting, ability, gender, and motivation. Not all the children have all the symptoms of ADHD. The types of ADHD include ADHD predominantly inattentive presentation, ADHD predominantly hyperactive impulsive presentation, and ADHD combined, which has both symptoms of inattention and hyperactive and impulsive behaviors. Once ADHD is diagnosed, it is important for the parent and school to be aware and understand the child's condition and how it affects them in their learning, school life, social and home life. Teachers and parents may need to use behavioral management strategies like timeout cards, reward charts, timetable, and making them sit in the least distractible place. At school, they may need specific educational support to help with daily work and additional time during exams. Parents may benefit from parent training programs to understand the behavior, enforce boundaries, and managing defined behaviors. Medications can play an important role in managing moderate to severe ADHD. They can help reduce hyperactive and impulsive behaviors and improve concentration. There are two groups of medications that we routinely use for managing ADHD. The first group are stimulants like methylphenidate and dexamphetamine. The second group are non-stimulants like atomoxetine. 1/3 of children who are diagnosed with ADHD will grow out of the symptoms and they can manage better. The middle third may go on to have symptoms, but they can use strategies and manage it without medications. And the last third may need medications on a long term, including when they are adults. Okay. Being aware of ADHD symptoms and how it affects your learning, school life, friendships, and home life, and how best to manage it will be helpful. It would help you to openly communicate your difficulties with parents and teachers so that help and support can be put in place at school and at home. Maintaining a healthy lifestyle with healthy eating, getting good night's sleep, exercise, and engaging in physical and leisure activities. If you are taking medication, need to be taking them regularly as advised by your doctor. Sometimes counseling or therapy can help with understanding the problems and find practical ways to better manage and cope with everyday life. If you're struggling with organizations, making lists and using timetables and reminders will help to manage things easily. Taking regular rest breaks within tasks that need long concentration and reading might help you do things better and also find ways of relaxing. Recognizing potential triggers that might make things worse and removing yourself from any stressful situations will make it easier for you to manage.